Okay, here we are for Infraspinatus and Teres Minor. Remember, line up your body parts, find the inferior angle, feel the spine of the scapula, knowing that infraspinatus fills the fossa here, and it has two divisions, one that comes from this vertebral border and one that comes from the spine of the scap. They actually converge, and so you have to search in this little depression here to find if they've got something there that's really causing them a problem. And then Teres Minor, remember, is right here on this edge, and so very close, high up in the armpit is where you're going to find that. So remember, the lower part, the lower 2/3 of the lateral border of your scapula is the origin of teres major, which in some books is called the 5th rotator cuff muscle because it does help stabilize the joint. It's also has a commingled insertion with latissimus dorsi, and so you can work on that at the same time if you want to. And remember, for latissimus, you're actually right here in the neighborhood because latissimus attaches to 4 ribs before it descends on its way to the iliac crest and then across the lumbar section of the vertebrae. But it has a few different attachments than people actually realize. So get some lotion. Always find your landmarks to be sure you're in the right area. Inferior angle, spine of the scap. In your mind's eye, just imagine what's underneath there. Go along the direction of the fibers if you want to first. You don't have to. You can go in any direction you want to. What are you looking for? Thick, dense areas, ropey strands, things that hurt. Now, how difficult is that? And search through, go underneath this border of the scapula, and search for things. Don't stop and press on anything the first time through. Just do your stroking. Do what I consider your investigation. You are making some determination. Okay, does this muscle really have a problem, or is it something that doesn't need to be worked on? Now, find the lateral border, which is here. You know, Teres Minor is going to be in this section here. Go ahead through that. Search for whatever you need to find. I like the arm in this position because the more, oops, sorry about the camera, the more taut you make the muscle, the less it wants to give up the problem when it is rubbed. So a technique from orthobiotomy is actually to slacken the muscle. The nodules will still show, and it's more likely to be responsive to your therapy. Go down along that border of the scapula and itemize teres major. You can actually grip the muscle and go through it in that way. Now, right here, I feel a little bit of a ropey strand. Is that uncomfortable, Bill?
Yeah.
Okay, so he's got a spot in here that is developing. He said he didn't have a problem with the shoulder, and maybe not today, but maybe tomorrow, maybe next month, maybe next year. I don't know when this will actually get ugly, but he's got something that has begun. Go sideways, back and forth on this, stroke it, and then remember what I said about not beating it. Go away. You gave it a few strokes. You don't need to just keep dwelling on it. Go down and work on the ribs right where a woman's bra strap would cross the rib cage. Women have developed that spot much more than men because of the constant pressure that's on it, but that is considered a key trigger point which will initiate formation of triggers in other muscles. And what the text also says is that if you eliminate the key trigger, the associated ones will disappear with no further therapy. Now, how cool is that? So if you work on key trigger points, you can do a lot of work that you never even touched. Are you sore here along the ribs? Okay, so he's got a soreness along this area. Remember that lat dorsi is such a long and slack muscle that you can have multiple contraction knots and still have full range of motion. The short muscles closest to the joint are the ones that distort people's posture the most and give them a restricted range of motion because the short muscle cannot compensate when it has a contraction knot, just the long one. Because the fibers are so long, they can go, okay, you know, we've got a problem here, but we can still get past it. So when you're working on this, you can take the arm up, actually put it right on top of their head, and just go down the entire side. Now, what we just got, you saw that was a jump sign. That means he's got something real irritable in here. And so it caused him, it sent a spark right into his central nervous system when I rolled over it, and it caused his body to flinch. So this is something that needs your attention should you find that. So go through this area right on their side. We love working the front and the back, and we forget that people have sides. Follow it on down if you want to. We're talking rotator cuff, but don't forget that the prime movers also have their issues. Go down and work on the iliac crest. Go do some big sweeps on the muscle and take the shoulder up at the same time to lengthen that section as much as you can. If you use something like a lotion, like a Prosage Heat, which is very dry, it helps you to mobilize the fascia and to stretch that area out. Then go back, search for whatever was that spot that caused the jump. Do you feel it somewhere else from here, Bill?
It may be down a little.
Okay.
Right there.
Okay, now, you see what I did. I actually want the participation of the patient, because if they understand what you're looking for, they will guide you to it. You don't always have to find things with your fingers. Let them help you with it. And it's good when they understand that there's a reason for what you're doing. There's a reason that they hurt. And this is not in their head, this is in their body. And if you can find it, you'll be the only one ever looking for it, because most of the people who come to you have been everywhere else and nobody has helped them because they're not looking for a muscular component of their problems. Then put the arm back down, go back through infraspinatus, back through Teres Minor. Deep stroking effleurage, remember, was the best way to eliminate central belly trigger points. You don't have to get fancy. Just do some deep, purposeful stroking. See, a lot of people are out there just doing wax on, wax off. They're putting lotion on and they're taking lotion off, and it means nothing. What you're doing with this kind of stroke is very purposefully stripping through a muscle to find a ropey strand and a nodule and things that hurt. So you do this multiple times. The repetition is the key. How many times did you go back to the same spot? And when you find something that's really irritable, which happens a lot at the inferior angle, there's sometimes a spot down there that can just be the devil on some people. And so when you get through stroking through, about the third or fourth time back, then you can add just pressure. Just hold the spot, and we'll talk about that, and I might have already in this class to talk about what the pressure does to finish off the rest of what you're dealing with here. But these four muscles have to work correctly and stabilize that joint for the prime movers, which is lat dorsi, deltoid, pec major. For them to be able to function correctly and exhibit the strength that they have, the joint has to be stable. So that's why we're always talking about making the rotator cuff group work like it should. So let's go on to subscapularis.